Attendees are in listen-only mode.
Good afternoon, everyone. This is Andy Dwyer working on behalf of Fight Colorectal Cancer in a joint appointment with University of Colorado Cancer Center and School of Public Health. So we're excited to bring a fantastic resource webinar series. Today we're going to be talking about the benefits of stress reduction with a longtime professional advocate and friend of Fight CRC, Andrea Lee. So we're going to go ahead and get started with our webinar. Just a quick apologies for just being a smidge late on our start today, but we'll still try to make sure that we make the most of the time and end on time. So Andy Lee will be joining us today. Just a quick reminder that all of our webinars are archived, so tell a friend, family member about the webinar series, and even repeat today watch on our fightcrc.org webinars site location. So we're going to talk a bit about this in just a quick upcoming slide, but we want to make sure that we get to the specific questions to address that you have today. A quick reminder that we will not be asking, we will not be actually providing feedback for one-on-one medical direction or care, but just general education information is what we can provide through the course of the webinar. And just a quick reminder that you can follow along on the social media sources listed at #CRC webinar. And we do like to have great feedback from how you're feeling about the webinar series, as well as all of our resources. So please be sure to get the email and survey and fill that out right after the presentation today. So moving on. Just a quick note, as I mentioned before, on the right-hand side of the control panel, and if you go into the Log Me In Go webinar platform, and you'll see the graphic there, there's a specific arrow that you can use and adjust in terms of inserting your questions. So Sharon will be facilitating a number of our questions after the session today. We might not have time to address all questions, and again, we do have to steer away from one-on-one direct medical advice for folks that would really love all of your general questions noted in that key bar. So with that, I also want to thank Sharon Worrell, who has done a lion's share of our patient education work and bringing in great topics and great programming, as well as Michael Sola, Daniel Burgess, Elizabeth, and Andrew, who are all part of the communications team, who will be following along to provide really great input through social media and provide great foundation for the work. A quick note that Fight CRC does have a bevy of resources, particularly noted in the Newsweek magazine with the late MSS CRC trial finder for folks who are really interested in looking at specific types of immunotherapy approaches and specific targeted therapies. Please check out our trial finder on our website, as well as a series of mini mags, which really delve into specific topics related to cancer survivorship and topics. So we're really excited about the new biomarker testing magazine, mini mag, which really goes into understanding biomarkers and what that means for treatment and outcomes. So many of you might have seen Clint Cummings and with the tattoo community, a lot of the publication and work coming out, and the folks that are on the cover represent a lot of that connection that we've made through the biomarker campaign with Clint and all of his great work as an advocate. Moving on. Just a quick note, as I mentioned before, this webinar, as well as all of our resources, are meant to help really give some great education, provide some opportunity, food for thought, but in no way does this information or anything that we provide through Fight CRC replace your direct medical care from a provider or other health individual. We want to ensure that you just ensure that if you do have an emergency or something that needs immediate care, we do use 911. And of course, if there's anything that needs medical management, please get in touch with your oncologist or primary care physician and team to ensure that you're following and addressing those specific needs and issues. So I'm happy to present Andy Lee, who I noted has been a longtime advocate and supporter of Fight CRC and has done tremendous things for the organization in terms of moving the needle in advocacy and making some great connections for the organization. So Andy currently lives in Dallas, working at Methodist Dallas Medical Center, and works as an RN, BSN, but has provided fantastic, great information, education, and spent a good amount of time and energy in understanding reduction of barriers, thinking about complementary and integrative medicine approaches, but then even really thinking deep about the communication, learning, and memory strategies. So we're really excited that with her championing these causes, that she's able to come in as an expert, and I should say medical provider expert, and really helping in with our programming. I also might add that Andy is going to be one of our featured speakers and folks who's joining us at the Colon Congress this year. And so a quick note that if you haven't registered for Colon Congress, there's still room. We will be really talking about the legislative priorities as it relates to our country, individual states, but we do have a lot of great opportunities for survivors and family members and friends of survivors to really connect with each other and actually have a good bit of education and programming that we're able to provide at the Colon Congress event this year. So Andy's going to be one of our great experts joining us. And with no further ado, I am actually going to punt to her to begin her presentation as we really think about the role of mindfulness in managing stress. So Andy, are you set?
Yes. Can you hear me okay?
Yes, beautiful. You sound wonderful.
Okay, great. Can I get rid of that? Okay. Everyone, my name is Andrea Lee. I'm very happy to be here today talking with you about the role of mindfulness in cancer care. Stress is something that anyone facing a threatening illness has experienced, and we'll talk about today how that impacts our health, our thinking, the way our brains function, and then mindfulness and what that is and how we can use mindfulness and self-compassion to mediate our stress response and improve the way that we experience cancer treatment. So hopefully by the end of this, you should be able to have a better understanding of how stress impacts our body. We'll go through a couple of exercises trying to give you some tools for real-time stress reduction techniques that you can use, and just a brief overview of the whole brain science, neurosciences, kind of at a more cellular level, but how those different areas of our brain are wired and fired together in states of well-being versus states of stress. So there's plenty of science in here. I'd like to start out with a poem. It's called The Journey by Mary Oliver. One day you finally knew what you had to do and began, though the voices around you kept shouting their bad advice, though the whole house began to tremble and you felt the old tug at your ankles. Mend my life, each voice cried. But you didn't stop. You knew what you had to do. Though the wind pried with its still fingers at the very foundations, though their melancholy was terrible, it was already late enough, and a wild night, and the road full of fallen branches and stones. But little by little, as you left their voice behind, the stars began to burn through the sheets of clouds, and there was a new voice, which you slowly recognized as your own, that kept you company as you strode deeper and deeper into the world, determined to do the only thing you could do, determined to save the only life you could save. So my journey in oncology started, I was the complex GI oncology nurse navigator. And in that position, as a nurse, I was afforded the unique perspective that not many people get. I got to sit at the very center of the healthcare team and walk patients through the system from initial diagnosis through treatment and into survivorship, helping the different specialists communicate with one another and really serving as a patient advocate. Not everybody gets to see how the whole, not every healthcare professional, patients definitely experience it, but healthcare professionals don't always get to see how everything works together because everyone's very subspecialized. And in walking that journey with patients, I came to know firsthand the impact that stress has on patients and caregivers and the uncertainty and what that brings, but also doctors and nurses and how that does their communication, even decision making. So after working in oncology for a couple of years, I faced questions of life and death that I didn't expect to be confronted with in my late 20s, and ended up going and taking a break, figuring there was more than one way to get an education in 2015 with the World Wide Web of information at our fingertips. We're all limited by the questions that we can ask and our own curiosity. So I put my house on Airbnb, which was also not something that would have previously been an option for women in other generations, and decided to really seek truth and information related to our human experience, the perception of it, and our thinking and judgment and decision making. And I read a ton of books and traveled all over the world and applying things and coming to understand mindfulness and stress, and then decided to come back and apply it to a cause that I care about very much, which is improving the healthcare system for people going through it. So currently, I work as the Oncology Program Manager at Methodist Dallas Medical Center, and what I know in this position is it's equally as important to have your administrators be patient advocates as it is doctors and nurses. So we improve the system. And one of the things that I'm working on here is promoting shared decision-making, which is physicians engaging patients about their values and preferences and using those things to guide treatment recommendations. So if I don't ask, you might not tell, which means that I'm going to recommend based on what I think you should know. But if you ask questions, what you bring to the table changes what I give back. A lot of those studies have looked at communication-based training thus far, and our approach is a bit different. It looks at stress and the role of mindfulness in reducing stress because of how stress changes judgment and decision-making and attuned communication, and we'll get to all of that. But working to improve the system. So I wanted to start out with just a little bit of an explanation about what it means to have an internally oriented locus of control. So locus of control is basically our focus. Externally would be our focus is on what is happening to me, versus internally you're focused on what you can do to change. So with a diagnosis of colorectal cancer, there are a lot of circumstances that are outside of our control. And if we're constantly focused on all these things that are happening to us, that increases anxiety and depression. It fosters a feeling of being disempowered and hopeless and helpless. And all of those thoughts have a physiologic response, versus being focused on what we can do. We feel empowered and hopeful. And there's a lot of freedom in this, but what I really want to impart on you is the mind-body medicine is not woo-woo. I think about within the last 20 years, the advances in neuroscience have really given us a much deeper understanding of what's happening with our thinking and how our brains are having, physiologic responses with our immune system, inflammation. So all of these things are, the content of our minds, the healthcare system doesn't really do anything to attend to. It's something that we can control, though. So cancer is almost like post-traumatic stress. A major function of our brain is to serve as a memory bank, and a pretty big one. So among the array of memories that are stored in that vast repository are all of the responses to the various situations and challenges we've encountered throughout our days, whether it's our responses to changing weather or food, or an unpleasant encounter with someone you'd rather avoid. How we react to those events and everything else in our life is stored inside of our brain. And how did it get there? It got there because we put it there through action. Every time something pleasant happens in our life, something interesting, something scary, even the fragrance of a flower, how you respond or react to it is inventoried by your brain and stored for future reference. So over time, the way that we perceive and react to various events and encountered sets up an automatic response. And those memories are stored as generalizations. So if I feel anxious, that is the generalized feeling that's the memory is stored as. So then the next time I feel anxious, one memory will co-activate the next, will co-activate the next, and then all of a sudden I'm feeling this tremendous amount of anxiety and can't really identify why. Well, we're going to touch on that, but basically the brain operates as a pattern matching machine that scans for familiar responses. So when there's a stressful situation, the brain looks through its memory bank and finds other previously stressful experiences, how we've responded to that, and finds a match and reacts accordingly. What I want you to know is that this brain circuitry is flexible and it can be reshaped based on the choices that we make. And those choices are what we choose to do with our thoughts. So stress is something that just about all people going through the healthcare system experience. Right now, we do virtually nothing to attend to it in the traditional healthcare system, and I believe that this needs to change. Because of the advances that we've made, we have new information and we need to integrate that. We're at the dawning of a new era, and this is being done in academic institutions all over the United States, but mostly on the East and West coasts, slowly making its way into more mainstream care. But as a patient advocate, the one message that I try to impart on patients is you can't exclusively rely on the healthcare system to provide all of the things that you need in order to effectively cope with a diagnosis, especially. And there's so many things that we can't control, but if we focus on what we can, that's one way that we can help ourselves. And hopefully transform post-traumatic stress into post-traumatic growth. So what is post-traumatic growth? It's a positive experience as a result of a major struggle with a life event. It's a little bit different from resiliency in that someone who's resilient when a trauma occurs won't necessarily experience post-traumatic growth because the resilient person isn't rocked by the event and doesn't need a new belief system as a result. However, maybe a less resilient person, which is your ability to bounce back after a struggle, may go through distress and confusion as they try to understand why this terrible thing happened to them and what that means for their worldview. So some of the exercises that we'll touch on here can help us to see situations differently, find silver linings. The post-traumatic growth inventory is one way that science evaluates whether and to what extent a person has achieved post-traumatic growth after trauma. There's 5 domains: appreciation of life, which is I changed my priorities about what's important; relating to others, I have a greater sense of closeness with other people; new possibilities in life, I'm able to do better things with my life; spiritual change; personal strength. And the research suggests that there's a link between mindfulness and post-traumatic growth. And as our internal locus of control begins to shift from being externally oriented to what's happening to me to internally oriented, what can I do to change the things I can? So I just wanted to take you through a brief exercise. I know that even talking about stress can create stress. Every word has an association, and that can come up different memories and emotions. So you can use these techniques as an effective way to anchor in the present moment and calm yourself when you're upset. So let's start by taking a deep breath and just draw your awareness to your breath. You try to control your breath, but just feel your breath in the body. You can feel the warm air that passes through your nostrils. And feel the rise and fall of your chest with each inhalation and exhalation. We're going to bring ourselves into the present moment. You can easily just ask yourself, what is happening right now in this moment? So start by directing your attention to the center of the room that you're in. Now direct your attention to the farthest wall. Now direct your attention to about a foot away, book's reading distance. Do you notice how you can change where your attention is directed? You can start to warmly observe yourself in three-dimensional space. Now, one simple thing you can do to ground yourself in the present moment is awareness of sensation. And this is drawing your attention to each of your five senses. So let's start with the sense of hearing. Let all of the sounds in your environment fill awareness. Notice how each sound comes from and falls away into the silence. Now, direct your attention to what you can smell. Are there any odors in your environment? Into your sense of taste. Feeling your tongue inside your mouth. Maybe even noticing how your sense of smell and your sense of taste are connected. And then let's draw your awareness of sight. And you can have your eyes closed or open, but let enough light come in that you become aware of the light shining on the objects in the room. Then draw your attention to your sense of touch. Feel the clothes on your skin, your feet rooted into the floor, your butt in the chair. Feel the distribution of your weight. Draw your awareness to the sensation of your hands. And I don't mean thinking about your hands, but rather feeling your hands, as if you're concentrating all of your awareness in the sensation. Now, as you're doing this, diaphragmatic breathing is one exercise that we use to regulate our sympathetic nervous system. You can put one hand on your chest and one hand on your abdomen. And as you inhale, inhale through your abdomen first. So you breathe down into your stomach. You can feel that hand rise first and then followed by your chest. And then feel your lower hand lower first. And then your chest fall with each in-breath and out-breath. And as you start to notice different thoughts as they arise, try labeling them. So typically, if we're not intentionally becoming aware of our thinking, one thought can lead to the next thought, will lead to the next thought, and before we know it, we've followed those thoughts down a rabbit hole that oftentimes produces a feeling of anxiety. And Labeling our thoughts, labeling our experience is one of the techniques that we can use to shift our seat of perception from the subjective experience of being our thoughts to the objective witness of our thoughts. You know, there's some schools of meditation that say every time you witness a thought to just let it go and refocus on the breath. And that's very effective. The act of drawing your attention to the thought and then refocusing, each time you do that, it creates a new synaptic connection in your brain. Our tendency is to judge our thinking. Good, bad, right, wrong. I shouldn't be thinking that. I should be thinking this. Instead of indulging in that constant stream of judgments, just notice. Notice the judgments. You can label them. Worried thought, planning thought. Just taking a few moments to become aware of your own mental activity. We're going to talk a little bit about how our thinking changes our feeling and how our feelings drive our thinking, and then ways to interrupt those patterns. But these are some basic exercises you can do anytime, whether you're in a doctor's office or a waiting room or just can't sleep at night. You can bring your awareness back into the body, back into the room. Take a deep breath in and we'll go on. So, wanted to talk a little bit about the why. Why does any of this matter? So stress has a negative effect on our telomeres, and our telomeres are the caps at the ends of our DNA that protect our DNA from damage. So as we get older, those telomeres start to shorten, and as they start to shorten, our DNA is susceptible to degradation. And what we see is the external result of that is sickness and disease. Elizabeth Blackburn, who's a PhD out of UCSF, won the Nobel Prize for her work with stress and mindfulness and telomeres. And it's really very interesting because mindfulness is shown to increase serum telomerase, which is the enzyme that protects those telomeres and the length of them. So essentially, mindfulness has a protective effect on our DNA. Stress negatively impacts just about every body system. So we've got over 100 billion brain cells in our gut alone. And every time we think an anxious thought, signals are being sent to those different centers in our bodies. One of the things that I've noticed, even with practicing mindfulness techniques, is I'll notice a stressful thought, and then not the next second later, my abdomen tightens. If something's just not right, I usually sense it in my abdomen first, and then I'll ask myself, well, what was I just thinking? So it also has a negative impact on our immune system and inflammatory response, which is implicated in pretty much every disease state, but definitely in oncology. So what is stress? Well, stress is a condition of mental, physical, or emotional disharmony, also called allostasis. There's a stressor, which is an event or a stimulus that causes the stress response. And then there's the stress response itself, which is the body's response to that stimulus. And that's what we're really targeting with mindfulness is the body's stress response and our habituated patterns of reacting to stress and how to interrupt those to give us a greater degree of control. So this is everything we experience in our daily life. There's an event or a situation external to us that causes an internal response. So something bad happens, or you're newly diagnosed and having all of these tests and procedures done and thinking, oh, this is so bad, this is going to hurt so much, or I'm so scared, this is so bad, I can't believe this is happening. And with every thought, we're sending signals to our body. So with every thought, there's a feeling, and that feeling then reinforces that thought. So the more I feel that way, the more I feel anxious, the more I think anxious thoughts, the more I think anxious thoughts, the more I feel anxious. And then that thinking, feeling feedback loop continues, and pretty soon I'm walking around as an embodied mental state, literally embodying my anxiety. So when we leave those things unattended to, they spiral out of control. But we know that we can either attack this loop at the level of thinking or feeling. So I can change my thinking to change how I'm feeling, or I can change my feelings to change how I'm thinking. And there's a number of techniques to do that, but they basically all boil down to, one, becoming aware. And that's what mindfulness practice really facilitates, is awareness. Awareness of our own awareness, or meta-awareness. So we recognize what's happening and then make room for that experience. Don't try to change it. Just allow it to be exactly as it is. Whatever we resist persists. But when we turn toward that experience, like with the labeling exercise, we can then get curious about that. So what am I feeling? What was I just thinking in relation to that feeling? Where does that feeling sit in the body? And when you realize that you're caught in that feedback loop, just take a step back. Warmly observe yourself in three-dimensional space. See your own reaction. Kindly, like you would with a small child, identify this is a stressful experience, or I am feeling sad right now. Just like you would with a friend who was struggling. And that act of labeling, just the act of observing your own mental activity, causes the mental activity to change. I'm going to say that a number of times throughout this presentation, but the act of observing your own thoughts changes the thoughts themselves. So what we want to do is intentionally infuse compassion in those inner dialogues. So we change the harsh self-critic, who is not really doing us any favors, into a kind inner monologue that gently mirrors the nature of how you would treat someone who was suffering. So when it comes to information processing and stress cues, there's top-down and there's bottom-up communication. So bottom-up communication is information that comes in first through our senses and then takes time to travel up to our rational prefrontal cortex, this area right here at the front, but just behind the forehead, where we make sense of our experience. Or there's top-down, where our thinking is overriding, our rational mind is trying to make sense of something. If we're trying to plan out a route or the best way to get somewhere, or how to put on a stoma, you're thinking this is how you peel the package open. So the unconditional ways we learn in childhood, we pick up these rules before we even have a chance to question what they are. We're given rules and facts and names for just about everything, and so we're led to believe that there's one single way of viewing things. But then at some point, somebody tells us that there are other people that might have a different view. And if you ask someone, is there only one way of looking at things? They're going to say no, right? There's many ways to look at things. And yet, for some reason, we live our lives as if there's only one way. And I think that this is really important because those meanings that we give to things, we can change them. The role of other people also becomes very important. You know, the relationship between a patient and a caregiver. The caregiver has to take care of themselves, has to attend to their own stress in order to be there for the others that they're caring for. Our brains are extremely social. Areas that are involved in self-regulation overlap with those that are involved in interpersonal communication and plasticity. So how one brain interacts with another has important effects on how those two brains function independently. Social interactions are one of the most powerful forms of experience that shape our brain and give rise to the content of our mind. It can be thought of as human connections shape neural connections. So by taking care of ourselves, we're also taking care of others. So this is just a simple way to think about the brain, but if you make a fist and you put your thumb in the center of the fist and the four fingers overlapping, curling over the fist, that thumb in the center of your fist is basically your reptilian brain. That's your fight, flight, freeze response that kicks in very quickly. Those habituated patterns of reacting that happen before our rational mind has had a chance to catch up with why. So that happens quick. That's what detects for threats, constantly scanning, just like we did back in the day when there were lions and there was some sort of imminent danger, although today the dangers look a little bit different and they're perceived dangers more often than they're real dangers. There's not a lion coming after us, but these different things that happen throughout our day, and in particular when going through cancer treatment. And those centers in the center of your brain are connected to your brainstem and your limbic system, which is what causes us to ramp up or slow down. So we detect a threat, our heart rate quickens, our respirations become more rapid and shallow, our pupils constrict and focus, zero in. So, and then our rational prefrontal cortex, those four fingers that are folded over that thumb, those govern our higher order cognitive functions. Those are the newer parts of our brain that we can rationalize. I'm safe right now. Nothing is a threat. I witness that I'm fearful and intentionally try to calm ourselves down. So approximately 40 to 45% of the time, humans are operating in the default mode. So we're engaged in mind wandering, rumination. These are, to the right, are signs that you're operating in the default mode. So mind wandering, rumination, confusion, distorted thinking, inappropriate negative reactions to things. We only see what confirms our beliefs and ignore what disconfirms our beliefs. It's called confirmation bias. We have all of these biases and shortcuts in thinking that help us to be more efficient. So we're not weighing too many different options and getting bogged down in our decision-making process. But if we're not aware, sometimes those can lead us down the wrong path. So we have a tendency to believe that the worst thing is the most likely to happen, even if it's it has the lowest probability of actually occurring. That's the one that we settle on. And again, by becoming aware of what's happening, we can become aware of how our brains are functioning. So, there's a stimulus in our environment that causes us to remember a past event, and emotionally charged memories are stickier. So they carry more weight. And then we use that to predict future outcomes. Some of these things, these are important to how we function in the world, but sometimes they can not serve us, and we want to maximize our efficiency, but we know that it's impacting how we relate to our internal and external world, and changes the stress hormones and ways our bodies are functioning, which is particularly important during treatment and after. So our prefrontal cortex, that area of our brain is actually strengthened through mindfulness training. Studies have looked at the thickness of those regions in our brain and found that people who practice mindfulness have thicker cortical thickening. There's about 9 functions of our prefrontal cortex. Body regulation, which is our sympathetic and parasympathetic nervous systems. So you can think of the sympathetic nervous system like the gas and the parasympathetic nervous system like the brake. You need both to drive smoothly, but you want it to be in balance. Attuned communication, which is our ability to resonate and tune in with another person. Emotional balance, generating positive states of being. We want to be able to experience the emotions of life without becoming so aroused that life is chaotic, or so shut down that life becomes rigid. And by finding that balance, we linger in a place where life has increased meaning. Response flexibility is our ability to consider all of our options before taking action. So mindfulness actually increases the space between impulse and action, which gives us more control over those habituated patterns of reacting. Our prefrontal cortex also governs empathy, insight, fear modulation, intuition, morality. It's what allows us to overcome those amygdala-driven fight, flight, freeze responses through top-down information processing. So ways to break out of this when you're in a thinking, feeling feedback loop. Remember, whatever you resist persists. So first, I always become aware of the feeling. I'll feel tightness in my chest or in my abdomen. And I become aware of it, and then I direct my attention to it and breathe into it. You can put one hand on your belly, one hand on your chest, anything that really feels soothing. Label the thought or emotion. When you notice yourself feeling stressed, you can say to yourself, worried thought, planning thought, or I'm feeling angry, confused, shameful. And just by witnessing the thought and labeling the thought changes it. It shifts your seat of perception from the subjective self experiencing the emotion to the objective observing self witnessing your experience. It's always crucial to do these things with an attitude of self-compassion. That harsh inner critic that so many of us have developed over time, we think that it serves us, but really it works against us. We think that it's what motivates us, or if we're compassionate with ourselves, then we're being lazy or weak. But it's actually the opposite. It's that self-compassion that allows us to move forward. By having compassion for our experience and accepting things as they are, then we have the ability to change them. When you become aware, you can reframe or reorient to your experience. So I always ask myself, is this helping or hurting me? how else could I see this situation that might be more beneficial? Am I seeing things as they are? Would anyone in my situation feel the same way? If that's the case, then I can choose to have compassion for myself. Or if the answer is no, I'm just seeing it this way, okay, well, how could I choose to see it differently that might produce a different result? And then every time we choose differently, we're literally rewiring the structures in our brain. So all of these areas, they develop in early childhood through attachment patterns. And what we know is that the adult brain in those same areas is actually highly plastic and can be reformed. Those associations can be reconnected based on how we use our mind. So the research in mindfulness has really gone up exponentially over the last 20 years. It's been researched in just about every disease process, and the results are really incredible. So what is it? I've given you two different definitions. Jon Kabat-Zinn is the father of mindfulness. He is a PhD out of UMass in Massachusetts, and developed mindfulness-based stress reduction, which is an 8-week program that is the most well-researched sort of gold standard of mindfulness. He's the most well-known mindfulness researcher, and he defines it as intentionally drawing your attention to the present moment experience with an attitude of kindness and non-judgment. Ellen Langer is referred to as the mother of mindfulness, and she's a professor of psychology at Harvard. And she offers us a different way to look at mindfulness that sometimes can be a little bit, maybe more accessible to people. She calls it a flexible state of mind in which we are actively engaged in the present moment and noticing new things. So one of the things that she points out is that you don't actually have to meditate in order to be mindful. You just have to notice novelty. And you can do that in any given moment. Notice the novel thing in your environment. Draw your attention to the textures of the objects in the room, the materials that things are made of, the way that light reflects. And just by actively noticing the novel thing, you're engaged in the present moment, and you're not engaged in mind wandering and rumination, and it pulls you out of that default mode network. So in science, we often understand one thing by understanding its opposite. So if that's mindfulness, then mindlessness is characterized as an inactive state of mind, where we rely on rules and routines to govern our behaviors. These are habituated patterns of reaction. This is our default mode, autopilot. If you've ever been driving from one place to another and get to your destination and have no memory of how you got there. So most of our suffering, psychological and physical, is the direct or indirect effect of mindlessness. You've heard the expression, the lights are on, but no one's home. The problem with that is that you're not there to know that you're not there. So when you're operating from a mindless state, something has to cue you to become aware of that. Mindfulness is the very simple process of actively noticing new things. You're engaged in the present moment. And the end game of meditation is to produce post-meditative mindfulness. Jon Kabat-Zinn talks about formal practice versus informal practice. So if you practice meditation in a formal setting, then informally it translates into how you live your life, the level of presence and engagement that you're able to show up with. And Ellen Langer basically says, you can do that without meditating. So that's what we use to mitigate the reactivity of our stress response. So I only put a couple of research articles up here, but there's, a really robust body of knowledge on the topic. These were a couple really interesting articles, and I've included them at the end, but one of them looks at cancer survivors' levels of mindfulness and how that in their primary support person. That study was done on 409 Hispanic survivors with a diagnosis of colon cancer, and it assessed perceived stress, dispositional mindfulness, and other health-related behaviors. And what they found was in both the survivors and in their primary support person, mindfulness was negatively associated with stress and poor health habits. So the more mindful you are, the more likely you are to have healthy habits, and conversely, the less mindful you are, the more likely you are to have not so healthy habits like smoking or drinking. In the survivor arm, there was an inverse association between mindfulness and fatigue, and that was mediated partially by reduced stress. So mindfulness reducing stress helps fatigue. The most interesting thing I thought was that the greater the level of the survivor's mindfulness, the lower the level of the stress in their primary support person. And knowing the science of it, that makes sense. We've just what we had talked about before. We're understanding the world of another person according to through our own experience. And so by you taking care of yourself or you being less stressed, I'm then less stressed. So despite all of these findings, that mindfulness has a great role in the health of survivors and their primary support person, very few patients actually report using mind-body interventions. The second study looked at cortisol blunting during chemotherapy in colorectal patients. So basically people were randomized to mindfulness, a 1-hour mindfulness intervention, or another form of a different type of intervention that wasn't mindfulness related. And then they drew their salivary cortisol levels. So cortisol is a stress hormone. So they checked the cortisol in their saliva at 20-minute intervals and found that, and also did self-assessments, and found that practicing mindfulness during chemotherapy reduced cortisol in oncology patients. So there's a number of different good physiologic effects. I'm going to skip the last one just for time. Basically, there's a lot of benefits to this practice. It decreases anxiety and depression, stress, improves maladaptive behaviors, decreases shame and poor body image. It increases happiness, satisfaction, gratitude, optimism, appreciation of our bodies. People who practice mindfulness have greater coping. They have more resilience, the ability to bounce back after stressful events, and they're more adaptive. Also, partners of people who are practicing mindfulness rate them as more giving, understanding, and better communicators. The attitudes of mindfulness are foundational. This is how we relate to our internal and external experience. So, non-judgment, for example. When we become aware of the constant stream of judging and reacting to our inner and outer experiences that we normally get caught up in, we might be surprised to discover that we're just constantly generating judgments about that experience. The mind labels and categorizes almost everything, and we react in terms of what we think the value to us is. But to handle stress more effectively, we have to become aware of those automatic judgments so we can see through our prejudices and fears. And again, we don't stop the mind from judging. We just become aware that it is. These different attitudes, acceptance, letting go, or letting be, a beginner's mind, each attitude relies on and influences the next. So working on one will lead you to others. And that really is what constitutes a strong foundation for mindfulness practice. And becoming familiar with these attitudes allows us to identify and use them both formally and informally. I think if I could impart anything on you, this might be one of the most important things. Whatever we resist persists. Suffering is pain times resistance. The more we resist the pain, the more we fuel it. Some of the most compelling stories that I've heard of cancer survivors who have used mindfulness while going through treatment were the pain was so much less than my thinking about how bad the pain was. And when I stopped thinking, oh, this is going to be so bad, or this is so bad, this is going to hurt so much, and was just present with the pain, it was really so much more tolerable than when I was just constantly trying not to feel it. I was going to show you a short animation that really is a very nice depiction of resistance. I'm afraid that it's not going to play, so I'm not going to click on it. But this is something that I reference kind of every day for me. It was a story about an old Cherokee man, and he said, "A fight is going on inside me. It is a terrible fight, and it is between two wolves. One is evil. He is anger, envy, sorrow, regret, greed, arrogance, self-pity, guilt, resentment, inferiority, lies, false pride, superiority, and ego." He continued, "The other is good. He is joy, peace, love, hope, serenity, humility, kindness, benevolence, empathy, generosity, truth, compassion, and faith. The same fight is going on inside you, and inside every other person too." The grandson asked his grandfather, "Which wolf will win?" The Cherokee man replied, "The one that you feed." I constantly ask myself, faith and fear are two sides of the same coin, and my belief in something is what drives my expectation, and my expectation is what drives my reality. So which one am I feeding? Which wolf am I feeding? Where am I investing my energy? Because if I have to choose, it would be with the side of kindness and serenity, empathy, compassion, and truth. However, we often feed the other wolf unknowingly. And awareness is what gives us the ability to choose. Mindful self-compassion, there's tons of research on this. Kristen Neff is the main mindful self-compassion researcher. Self-compassion, we've talked about a little bit. It's how we're oriented to our experience. We have an internal narrator that's dictating the story of our lives, which can have a critical or compassionate tone. Attention and awareness training, which is mindfulness, is cultivating an attitude of self-compassion that can result in a practice that is kind. So there's three basic components of self-compassion. It's self-kindness, common humanity, and mindfulness. So self-kindness versus self-judgment, treating yourself with care and understanding rather than being harsh and critical, actively soothing and comforting oneself when you're experiencing struggle. Your common humanity versus isolation, so seeing your own experience as part of a larger human experience, not isolated or abnormal. And then recognizing that life is imperfect. So expecting perfection is irrational. The last component is mindfulness versus over-identification. So that's what allows us to be with the painful feelings as they are, rather than encompassed in them. It avoids extremes of suppressing or running away from painful feelings by just allowing them to be. This is a really quick spot check that you can do when you notice that you're feeling stress or emotional discomfort. First, you would notice the sensation in the body, breathe into it, and then take a moment and say to yourself, this is a moment of suffering. That's mindfulness, labeling your experience. You could also say, this hurts, or this is stressful. Next is, suffering is a part of life. That's the common humanity piece. You could also say, I am not alone. Others are just like me. this is how it feels when a person struggles in this way. Then put your hands over your heart or wherever it feels soothing to you. For me, I just touch my hands together, feeling my palms against one another. And say to yourself, may I be kind to myself? Or may I give myself what I need? See if you can find the words for what you need in times like this. If you're having difficulty, imagine that you're speaking to a dear friend or a loved one that's having the same problem as you. What would you say to that person? If you would leave with just a few words in mind, what would you want your friend to know? What would those words be? Then see if you can offer that same message to yourself. May I accept myself as I am. May I forgive myself. May I be patient. And if you try this a couple of times, it really is very incredible how it works. Again, so much science. I'd just like to end with a poem called Allow. There is no controlling life. Try corralling a lightning bolt, containing a tornado. Dam a stream and it will create a new channel. Resist and the tide will sweep you off your feet. Allow and grace will carry you to higher ground. The only safety lies in letting it all in, the while and the weak, fear, fantasies, failures, and successes. When loss rips off the door of the heart, or sadness veils your vision with despair, practice becomes simply bearing the truth. In the choice to let go of your known way of being, the whole world is revealed to your new eyes. Just a couple of resources if you want to read more about mindfulness. Greater Good Science Center is through the University of Berkeley. It's an incredible resource for just about everything you need, whatever questionnaire you want to take or article or exercises to increase gratitude and self-compassion. You know, each one of these different domains has been extensively studied on its own. So there's different exercises that you can practice, and every time you do, that trains your brain. It essentially primes it. So the more you focus on gratitude, the more in a formal setting, then you'll informally start to notice things that you're grateful for. Just like looking for silver linings in negative experiences, finding the good in the bad, when you intentionally do that, then you unintentionally, naturally do it throughout your day. And all of those things are tied to happiness and well-being and obviously have very beneficial physiologic impacts. UCLA Mindful Awareness Research Center, or the MARC, they have guided meditations every Thursday, and they put them all online. They're free. They're wonderful. Kristen Neff is the self-compassion researcher. She's got some exercises that are available for free on her website, along with some other guided meditations. Mindful.org always has good articles, and if you're interested in getting an assessment of your own self-compassion, you can take the test at the Center for Mindful Self-Compassion.org. So that's all I've got.
Thank you so much, Andy. This is Sharon Worrell with Fight CRC. That was a wonderful presentation. I'm just going to go ahead and take these presenter back here. So I think we have just a couple minutes, maybe 2 minutes, 3 minutes or so for a couple questions. I know we went over on our time here, but we do have just a few questions, Andy, if you have a couple extra minutes.
Yeah.
So our first question, with regular practice, how long will it take to become more mindful versus mindless?
Your brain is just like any other muscle. The more you do it, the stronger it gets. So it can be slow in the beginning when you're just setting out, and my advice is please do not get discouraged. Literally, if you have a meditation practice for 10, 20 minutes, the goal is not to not think. The goal is to witness your own thinking, to let it go, bring it back. And every time you do that, those centers get a little bit stronger. So I would love to be able to say, practice every day for 2 weeks and you'll notice, big improvements. That's going to be different for everyone. I will say you can notice immediate effects right after your practice. But the longer you meditate, the greater your own self-mastery becomes. It's really a very fascinating phenomena. So if you were to start a practice now, then you would gradually start to see more and more of an impact. If you were to do a 21-day meditation challenge, I think it's worth, experimenting and seeing where your baseline is.
Great, thank you. 2 more questions. Would a mindfulness practice be done in conjunction with mental health care, or would it replace that?
I think it's definitely, just depending on the situation, it can be definitely both. If you're seeing a psychiatrist or a psychologist, mindfulness practice would augment that. So you would become more aware of the thinking that's fueling the feelings that's driving the behavior. And then you would be better equipped to be able to address those things. I think, having that external opinion from a professional or trusted source can be helpful in helping us work through stuck places. So when we become more mindful of our thinking, if we can't shift our thinking and we get stuck in it, then that awareness of our own thinking doesn't feel like as much of a benefit. And that's going to be different for everyone, but I would use them together, but you can definitely use them on their own just to calm your stress response. It depends on what your goals are.
And our final question, as a caregiver, where can I go for support for this type of practice?
Well, so I listed a number of different resources. If you have any questions, please feel free to reach out. Always happy to talk with patients and caregivers, survivors, anytime. Please feel free to send me an email. I'm not real sure what resources there are for caregivers specifically. I will say that there is a great book called Mindfulness-Based Cancer Recovery, and that is mindfulness tailored toward cancer patients, survivors, and caregivers. That can be a really great resource.
Awesome. That sounds like a great book. Well, Andrea, thank you so much for your time and for a wonderful presentation. And for all the viewers out there, thank you for joining us. If you have any questions or want to talk to someone real time, of course, you're welcome to call our resource line. The number is on the screen. And thank you again, Andy, and have a wonderful day.
Absolutely. Thank you so much. I'll see you at Call on Congress.
Awesome. Bye.
Bye.